Assalamualaikum and may everyone be healthy. Today, my friend and I will present the academic paper title, which is COVID-19 Vaccination Should Be Mandatory to Children in Malaysia. This is our group member, and without wasting time, I start with the introduction. As the title states, it is still debatable whether or not it is best to immunize all children under the age of 12 against COVID-19. The main goal of immunizing healthy kids is to shield them from long-term consequences. This paper argues to make the case that Malaysian children between the age of 5 and 12 should receive the COVID-19 vaccine as a requirement. COVID-19, which started in Wuhan, China, was detected in December 2019 until now. From the statistics of the World Health Organization until September 3, 2022, it was found that a total of almost 40,000 have died in Malaysia, and a total of almost 5 million have been infected with COVID-19, with 41 cases leading to death in children. This indicates how serious COVID-19 is in Malaysia. There are also statistics showing the consequence of taking the COVID-19 vaccine, where almost 80% experience side effects, 61% experience injection site pain, and almost 50% experience fatigue. Among the symptoms of COVID-19 are experience of fever, cold, tiredness, loss of taste, headache, and sore throat. These effects are experienced by adults as well as children, who are the main focus of the study due to the fact that the Malaysian government has not yet enforced the taking of this vaccine for children under the age of 12.
There are a few benefits for COVID-19 vaccinations, and we had stated down five different benefits, which are protection against COVID-19, assist protection our child, dispel popular myths and discover the truth, prevention of community transmission, and high rates of effectiveness. Well, for protection against COVID-19, the advantages of receiving a COVID-19 vaccination outweigh the risk. Both known and unknown vaccinations have been shown to lower rates of common childhood disease and in some cases result in the complete eradications of diseases. Assist protection our child, of course, vaccinations help your child physical and mental health. Getting children and teenagers immunized against COVID-19 can help them avoid becoming seriously ill if they do contract it. Dispel popular myths and discover the truth. Conspiracy theories make people less likely to get vaccinated because they spread irrational fears about vaccine risks and make people feel helpless, disappointed, and suspicious of the government. People tend to believe more conspiracies during crises when they feel vulnerable, uncertain, and uneasy. Getting a COVID-19 vaccine is a safer and more reliable way to build up immunity than conspiracy. Number four, prevention of community transmission. Vaccinating children also helps to reduce transmission, which lowers the probability of new virus strains rising and mild cases in adults. The COVID-19 vaccinations decrease infection as well as illness and high rates of effectiveness. FDA approved medications are clinically tested before release to the public. Pfizer biotech vaccine has been shown to be 94 to 95% effective within 2 weeks of full inoculation against the original strand of the COVID-19 virus. Vaccines also show high numbers of efficacy protecting people from serious illness from COVID-19 variants.
Assalamualaikum warahmatullahi wabarakatuh, and I'm Amma. I will talk about risks of COVID-19 vaccination. There are 4 risks of COVID-19 vaccination that we found. First, risk of adverse effects. Secondly, efficacy against long COVID unknown. Thirdly, limited vaccine supply. And lastly, long-term safety unknown. First, risk of adverse effects. The COVID-19 vaccine is being tested on children for the first time. Everyone aged 6 months and older should receive the vaccine, and those who are eligible should receive booster doses at age 5 as well. Parents' acceptance of the vaccine for children was found to be significantly correlated with a number of factors, including compliance, faith in vaccine safety, and their parents' age. Besides, efficacy against long COVID unknown. People are most protected when they receive the recommended number of doses and boosters. The primary strategy for containing the current SARS-CoV-2 epidemic is believed to be vaccinations. In a randomized placebo-controlled trial, the Pfizer vaccine was found to be 95% effective in preventing COVID-19 illness. People who had received the vaccine experienced a 66 to until 85% decrease in infections and a 90% reduction in serious hospitalizations. Moreover, limited vaccine supply. Vaccination of persons at a higher risk of developing COVID-19 and passing away, such as healthcare professionals, may be given priority over other users of the limited supply. mRNA vaccines have a higher immunogenicity in youngsters, which suggests that one dosage or a lower dose may be adequate to protect this age group. The infrastructure to scale up manufacturing of the vaccines already exists. Lastly, long-term safety unknown. The most common side effects for age 5 to 11 years of age were arm pain, redness, and swelling at the injection site. This is typical with many other vaccines as well. Children and adolescents tend to have milder disease compared to adults, unless they are part of a group at higher risk of severe COVID-19. It is less urgent to vaccinate them. And last but not least, we found a new risk of COVID-19 vaccination, which is Guillain-Barré syndrome. Guillain-Barré syndrome is a rare disorder that occurs when the immune system accidentally attacks the nerves coming out of the spinal cord. Most people affected recover fully. There have been very rare reports of cases of Guillain-Barré syndrome after vaccination with the AstraZeneca and Johnson & Johnson or Janssen COVID-19 vaccines. It is not yet known whether these cases are connected to or caused by the vaccines.
Assalamualaikum and hi. My name is Hanif Nur Iqmal. I will present about conclusion for our topic, which is mandatory for Malaysian children aged 5 until 12 years old. We observe both the benefit and downside of COVID-19 vaccine for children. Policymakers should take extra measure in light of the probable negative effect of the COVID-19 immunization in youngsters. Firstly, maintaining vaccination confidence is certainly critical in order to safeguard healthy youngsters. Second, there are hazards related with the various vaccination, particularly the current mRNA and the viral vector vaccine. Due to the low projected advantage of COVID-19 immunization in children, even infrequent consequences are particularly significant to the morality of COVID-19 of routine COVID-19 vaccination of healthy children. The COVID-19 vaccine benefit has the potential to drastically lower the cost of medical treatment, and Malaysian world-class medical facility guarantee that all of our children receive the best possible care. Public trust in immunization is take years to create and day to break especially those given to the children. Due to infrequent and chronic vaccine-related danger in children, whether as a result indicate vaccine practice, manufacturing technique, or inherent risks in the vaccine that were not detected in the first testing pass studies, the public trust in the relevant immunization and vaccine in general. The general has suffered a setback. Maintain a 1 meter distance from somebody who doesn't appear to be feeling well, as indicated. Wear a mask while you are out in public, especially if you can't physically get away from someone. If you indoor, open a window, wash your hand frequently, use soap and water or an alcohol-based hand rub. When times come, get your immunization. Follow local immunization guidelines. If you are feeling ill, stay at home.